the Director of Family Services, and he is the place where when our frontline manager, nurse, doctor says, I have somebody that I think might make a good advisor, they're referred to Bernard's office, and the person is then screened. We make sure everybody's screened. They're invited to participate. They have an orientation. They have some training. They sign confidentiality forms just like other volunteers. And we bring them into our culture of partnership, and that's handled through this Office of Family Services, and that's very important. It doesn't take a lot, but it is an important part of organization. For your benefit, we've listed here what are good characteristics of an advisor, and there are certain qualities we look for, and they're listed here. And obviously, Nettie Engels is one of our more senior patient advisors, and she really reflects the values of partnership. We're listening to each other. There's a lot of give and take. And the person's able to get above their own issues and think about themselves as representing patients as a whole. Here's a couple of pictures. We have 4 institutional level councils and a number of program level councils in our organization, even a group of children who help advise in the Children's Hospital. What's the impact of patient and family-centered care in the last few minutes here? Well, this slide was developed by our CEO, Don Snell, and from his perspective, patient and family-centered care has made a difference in the overall experience of care, in our clinical quality, in our professional liability, improving our payer mix, improving our market share, improving the overall profitability of the system, and even our access to capital. We now have a $135 million program of improvements to the Medical College of Georgia Hospital and Clinics campus, and all of these things have in part been made a reality by our partnerships with patients and families. Here's an example. This goes back to about 2003, this slide, and it shows the improvement in overall patient satisfaction that has occurred. We now are bumping up and into the area where we really wanted to be at the overall level of the 75th percentile. We use Press Ganey, any of you that are familiar with that, but in the top quartile of hospitals, that's where we want to be, and we actually are beginning to hit that on a regular basis. And we can go back and see each year, year after year, how we have added patient advisors into our system. Last year, we added 100 advisors for all of our clinics, and we can tell how this is helping us to improve the experience of care. This is a slide about overall risk-adjusted mortality, which has been continuously coming down, and this slide needs to be updated because we're right down here further below the 1.04 level as we sit here today. And again, we believe that our partnerships with patients and families where we're listening, we're getting more information up front, is helping us to improve overall quality outcomes. This is a fantastic slide which shows the historical pattern of risk and loss in our malpractice, and it's been published by the University Health System Consortium. And what has happened over a period of time outside of one case in 2005 to reduce our overall costs of malpractice. And here are some other outcomes I think are important. This close to the ending slide, we have made Solution Thompson Top 100 Hospital in 2002, 2007. You know, that is literally the top 100 hospitals in the United States, and we made it in our 2 years out of the last 8 in our division of teaching hospitals. We also are very proud of the Advance for Nurses. This is 58,000 nurses in the Southeast who selected both our adult and children's hospitals as quality places for nursing to practice, and we take that as a real source of pride. And the Community Value Index, frankly, we are a lean organization bringing value. So we are the only hospital in Georgia to receive that particular honor. So where can you see patient and family-centered care? At the Medical College of Georgia, you can see it really in all kinds of places, whether it's our wonderful Children's Hospital, which opened in 1998, in the Breast Health Center, which I mentioned, and this is the little space where breast health patients recover from biopsy. Or you can see it in planning for new programs and services where patients and families are right at the table with us. Or a Neuroscience Center of Excellence, which has been published over and over again for their very fine work, where families in an ICU are able to be present 24 hours a day, 7 days a week, participate in codes, even brain death. And where you see things like healing arts. This is right outside on the Neuroscience Center, a gentleman playing the flute. I tell the funny story of we have a harpist who plays several times a month on neurosciences, and a man who came out of surgery, and he woke up, and what was he hearing but the harpist? And he wondered where he was, I guess, when he first woke up. But in any case, it's a journey for us. It will be a journey for your organization, but it is one where everyone in healthcare wins. So here's a couple questions to take home. And we use these questions a lot in our own organization with groups of staff or physicians that we're working with. And these questions are, just think about, from your perspective, what kind of changes could you make in your practice every day, either as a frontline caregiver and administrator, to improve the experience of care? Everybody can always think of something. And then also, think about what changes could you make in the whole system of care where you're located. And again, each one of us have ideas for that. And with that, we do, Nettie and I both express our privilege to speak with you today. We are passionate, hopefully you can tell that, about patient and family-centered care. We host organizations from throughout the United States and Canada at least 3 times a year, helping them to see in our learning labs what this is all about, and it takes 2 days. So it's hard to pack all this into 1 hour, but we certainly are happy to share it, and we'll be happy to be available to anybody to provide support for your work. We also have a website, cpfcc.org, where you can see some of this work in more detail. And we thank you.
Well, that ends our seminar. Thank you, Pat Sadomka and Nettie Ingalls, for your time and willingness to share your information and experiences. Also, thanks to all of you who participated. We're glad that you could join us and hope the session was helpful for you. Don't forget to fill out the online evaluation to receive your CME credit. Please take the time to click on the survey link that is located on the screen. If you are unable to click on the link, an email will be sent to you with the survey. Thank you again, and enjoy the rest of your day.